Morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's Wednesday news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, Dr. Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll open it up for statements from our panel, and then we will take direct questions from our media members who are in attendance. Let's go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm fine, Dave. Thank you. And hello, Amarillo. I think it is important for us to note what's happening in our city this week. It's historic. We never expected to be in a pandemic, and it's not like a tornado where it happened and moved on. It came on us, we've been in it, and now we're at the next phase of the pandemic, and that is vaccinations. So I think it's important for us to pause and to realize that we're living through history. And that someday people will look back on December of 2020 and they'll note this week in history is when the vaccines arrived in our city for coronavirus and the first people received COVID-19 vaccines. So I'm just very, very thoughtful this week about what that means for us and the fact that it reinforces the hope we have that there is an end to this situation. And while I can't pick the exact date for us yet, I can tell you, Amarillo, there is an end to this situation. And so I want to thank you for what you're doing, either as a small business owner, as a healthcare worker, as a child care worker, somebody on the front lines helping our economy stay open. If you're in the school district, or even just parenting kids that are doing virtual learning or learning differently this year. All of us are in this together. And I just want to take note that, and there is an end in sight. So thank you to the panelists and the doctors that are on this call. I'm anxious to hear the reports that you have, and especially more information about the vaccine.
Thank you, Mary. Thank you. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you today?
Well, Dave, thank you. I'm glad to be here this morning. So first we'll talk about the local numbers, and then we'll talk a little bit about kind of the operational side of the vaccine, and then we'll hear from the healthcare providers and how they are rolling that out this week. As of yesterday, there were a total of 27,279 cases of COVID-19 here in Potter and Randall counties. 14,415 cases in Potter County and 12,864 cases in Randall County. We have a total of 20,336 recoveries and 421 deaths to report here in Potter and Randall counties. That leaves us with 6,522 active cases. At today's 2:30 report card, the case counts will be updated as our staff are providing data entry right now. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is down to 12%. And the positivity rate at the drive-through testing site, which is a subset of the total, is at 32%. The 5-day positive new case average is at 256 new cases per day. So we're certainly seeing good news on those numbers fronts, but we can't let up those public health prevention efforts like masking, social distancing, staying home if you're sick or exposed. Those efforts are working, and so we can't let that up. The public health drive-through testing site remains operational. Individuals can call 378-6300 to be screened and directed to the test site. Our community does remain at status level red, as all indicators remain consistent with those thresholds that are consistent with the status level red. GA32's hospitalization rate for the 25 Panhandle County RAC Region A has been over 15% for over a month now. Yesterday's RAC hospitalization percentage was at 29.72%, meaning that just over 29% of all hospitalized patients have COVID-19. We do have great news about a vaccine. So the Pfizer vaccine, the BioNTech COVID-19 vaccine, was approved by the FDA and the ACIP, and that is great news. We did receive our first shipments yesterday. That vaccine has been approved for people 16 years of age and older, and that's specific to that Pfizer vaccine. This vaccine requires 2 doses, at least 21 days apart. It has to be 21 days or more. There is a 4-day grace period, and that's consistent with other vaccines. But if you get that vaccine more than 21 days apart, then you want to get it as soon as possible, but you don't have to start that series over. You just pick up where you left off. The vaccine brands are not interchangeable, so we do expect additional manufacturers to put those vaccines to be released shortly. And so the vaccines aren't interchangeable. So if you get the Pfizer vaccine for your first dose, you need to get the Pfizer vaccine for your second dose. The vaccines should be offered regardless of history of COVID-19. So if you have had COVID-19 in the past, it's advised to go ahead and get the vaccine when it's offered to you. It's important to still use those public health prevention efforts, even if you've been vaccinated. So again, such as masking, social distancing, staying home if you're sick or exposed. And there's several reasons for that. One being the vaccine isn't fully recognized, so your immunity isn't fully recognized until 1 to 2 weeks following the second dose of the vaccine. And so you still want to wear your mask and all of the public health prevention efforts even after you've been vaccinated. No vaccine is 100%. While we're seeing great efficacy in these vaccines, 95% is just tremendous in a vaccine, but there's still a potential for 95% is 100. And so while it's tremendous, you still need to practice those public health prevention efforts. And the third thing is there'll be limited doses of vaccine available, especially at the beginning as the vaccines are rolling out. And so we still want to protect ourselves and each other. We're in the home stretch. This pandemic has certainly felt like we're running a marathon and we don't know what mile we're on. And so we need to finish strong. We need to keep running together so that we all cross the finish line together. I think we do that by certainly being vaccinated, wearing our masks, social distancing, all of the things that we've talked about. But it feels like we're getting there. We're getting closer to the finish line. We certainly want to finish strong and finish together. That's all I have today, Dave.
Thank you, Casey. Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Good morning, Dr. Milton.
Good morning. Yes, I thought those were great messages by the mayor and by Casey. Certainly, we need to remain vigilant with our practicing of social distancing and wearing a mask. And clearly, our numbers are down, and I don't think that's necessarily any coincidence with our masking order either. I think that's been important. I have personally noticed that people are more compliant with wearing a mask in the community. And I applaud and encourage these small business owners and all individuals to continue that, because I think you're starting to see that in the numbers. We certainly had a lot of cases here as well. So a lot of people have been exposed, but I don't think you can argue that these numbers have also improved with the masking. And so I'm very pleased with that. On to the vaccination. I received my vaccination yesterday with Dr. Weiss, and it went just fine. I have a couple of comments about that. Dr. Weiss and I had ours together. I'm jealous of his t-shirt. I don't know how old it is though, but that rock group is from the 80s. So maybe he could tell us about that. And he also said that he could already feel it working yesterday. I couldn't feel it working yesterday, but I'm convinced it's working today. So I think that's all good news. I don't have a third arm growing out of where I've got vaccinated. It's a little bit sore. It's just like a flu shot. So it's not a big deal. So anyway, I'll leave it over to Dr. Weiss and Dr. Lamatier.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you today?
Well, Dave, good morning. As a nice change, I am optimistic, and for a number of reasons. So, first, talked about Dr. Milton. So about that Rush T-shirt, I've been a diehard Rush fan since I was a teenager, and they were the first ones that got me interested in science. And so I just felt with the momentous day yesterday was that I had to share my Rush T-shirt with that moment of science. So thanks for bringing that up. Their songs were playing in my head yesterday. So anyway, I think if there's a silver lining to this whole experience, it has been the fact that our city, our hospitals, our Texas Tech have all learned to work together beautifully. And I've really come to appreciate all my colleagues in all these organizations. And I feel like I've made a lot of new friends during this time. And this has been very meaningful. This vaccine, this was a big deal. And we knew it was going to be hard to coordinate all these efforts. We didn't have any real idea how much we were going to get, when we were going to get it. But the bottom line is we've all worked together to make sure that this first shipment that is really meant for the first line healthcare workers, for the first line providers, was going to be equally distributed between Northwest and BSA, so we can take care of those folks that literally have been fighting this battle right on the front for 9 months now. And that's what we started yesterday. And that was fantastic. I think in terms of the logistics at our hospital, we had an incredible team of pharmacists, our nursing leadership, our information technology folks, and our plant engineering, who all put together this infusion center for us. Because there's a lot of details here about how do you store the vaccine, how do you handle it safely, how do you make sure that patients are getting through effectively, and most importantly, that we're reporting it to the state properly. Because as Casey mentioned, another vaccine is necessary 21 days later, and the state is holding that second dose for everybody, and we'll release it based on the reporting we do to the state. So we've got to make sure that reporting is done properly. As Dr. Milton said, I felt honored yesterday to get one of the early vaccines. And my vaccine was given to me by one of my clinic nurses, Marisol, who did a phenomenal job. I barely felt the vaccine. And I can tell you today, I took kind of an impromptu poll among a number of people who received it yesterday. And besides a little soreness in the arm at the site of the injection, everyone feels great. So this is very exciting. And as Casey mentioned, this is the beginning of the end. And I think the mayor's put it too, is here we are, we're at the 1 yard line. We're just going to punch it in over the next coming months, but we have to keep our guard up until that time. Now, the other reason I'm optimistic is, as Dr. Milton said, our numbers are down. This is fantastic. So today we are at 88 positives in Northwest. Just to remind you, over the last 6 weeks, we were always in triple digits. Over the weekend, we fell below 100, and now we're at 88 today, and that's fantastic. And we've got 38 patients in the ICU with COVID. We have 20 on ventilators. The sad part is we have had 46 deaths since the beginning of December. Now that's the tragedy of this. And here we are halfway through the month. That puts us on a trajectory to have 92 deaths in this month. I hope that's not the case. And I hope with these reduced numbers in the hospitals, we'll see a reduced number of deaths too. Our outpatient testing was at 13% positive yesterday. Again, a month ago, we were upwards of high 20s to low 30 percentile. And I'd say over the last week, we have stayed below 20% on the outpatient testing. I completely agree with Dr. Milton. I think a lot of this is due to the fact that we're all being more conscientious about wearing masks. I know when I go out to stores, it just seems that many more people are being very deliberate about wearing that mask, and this is making the difference. Between the mask wearing and now the vaccine, I am hoping that we are seeing the final descent out of this pandemic in Amarillo, Texas. Now, other things, the Nivimav. Now, that's the drug that we've been using as an outpatient. That's an antibody. Right now, we have given 51 doses of that to people who qualify for it. Again, you have to qualify for it based on certain medical issues. Right now, everyone's tolerating it very well, and we are seeing people that seem to respond to it beautifully. We are setting up a citywide process that we hope to open up within the next week, where all the providers in Amarillo can refer patients for this infusion to a centralized city location. And then with regard to the remdesivir, that's the inpatient drug that we're using. We have treated a total of 576 patients with that. And we have 17 currently on the medication. There too, we believe that in combination with Decadron or dexamethasone has also benefited a lot of the patients both here and certainly at BSA and in the VA. We will continue to do elective procedures case by case, but for the most part, we've been able to accommodate the vast majority of procedures that patients need to have done that are not completely elective. And lastly, I want to end, we've talked about our staffing and what an incredible job our nurses have done this whole time. We are still at about 160 plus visiting nurses through the Regional Advisory Council. We know that a lot of those nurses will start to demobilize for the holidays and as they're needed at other locations. So we continue to now bring back our employed staff and make sure that we have them in a good position to be able to take over as a lot of these visiting nurses leave. But I do want to thank all the visiting nurses, visiting doctors, visiting respiratory therapists that have really helped us bridge us through this time. And I wish them well. I hope they have great holidays. I'm also hoping that we won't need to have them come back as our numbers continue to decline in Amarillo. That's all I have today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you today?
Good morning, David. I'm doing well. And good morning, Amarillo. Thank you for letting me be on this panel again today. I enjoy our weekly reports and the ability to kind of convey to our citizens where we are with numbers, where we are with some hot topics, and just keep people informed about what's happening in our healthcare community, specifically for the two hospitals. I'll start off with some statistics before I get into some of our discussion points that I want to touch base on. Today, we're at 145 confirmed COVID cases in-house. Of those 145 confirmed cases, 70 of them are requiring ICU care. We have a total of 78 patients in our intensive care units. So you can see that the majority of patients in our ICU are still COVID-19 patients. In addition to that, we're using about 60% of our total ventilator inventory. And that inventory was augmented, as we know, by the rack supply that we got beyond ventilators that we purchased ourselves to augment that potential need with enhanced capacity. We are working through some maneuvers in an attempt to try to have our ICUs be most accommodating for the types of cases that need to come through for emergent and necessary surgeries, and keeping those patients separated from the COVID-19 ICU patients so that we are able to preserve the utmost quality of care and keep patients in a really demarcated unit. I'll say that everything you heard before my chance to speak here today, I would echo, and that is that this is an historic day. We have a lot of smiling faces walking through our hospital in terms of the staff members that are coming through to get their vaccinations. We did our test run on vaccinations yesterday to ensure that we had the workflow and process ironed out, and to make sure that our documentation process was appropriate, so that the state of Texas, in addition to our health system, are getting the necessary data we need in terms of being very fastidious with the results and also the number of individuals that we're vaccinating with the appropriate lot numbers, et cetera. I can't say enough how the collaboration between the leaders in the healthcare community has been outstanding. Dr. Weiss and his team, Dr. Milton and his team, we have really worked together, Dr. Bell, with making sure that the vaccination is provided to our frontline workers first and foremost. And then we have a plan to work that through individuals that are also in the healthcare field, but not necessarily in the walls of the hospital. So again, we can keep those individuals hopefully healthy to manage any potential upcoming surge that could happen before we're able to get the vaccine to the mass public, which hopefully will be sometime in the first quarter, if not the early second quarter of 2021. I will have to say that we've had now at least 100 vaccinations since this morning. and they're going extremely well. People are tolerating the vaccine very well, no complaints. We are very happy with how the process is working in terms of the logistics. We are also excited about hearing that additional vaccine is headed our way for both hospitals and our community. And again, I think we're going to be able to efficiently utilize 100% of the vaccine that comes our way. And once we get through, our staff go through the appropriate guidelines outlined by the state and our local public health department about who gets the vaccine next in terms of the most at-risk populations. In addition, I'd like to talk about the monoclonal antibodies that Dr. Weiss mentioned. We've now infused over 30 patients with monoclonal antibodies at a couple of different locations. Number one, for appropriate patients that don't require admission and meet the criteria under the EUA, that's the early use authorization. We're giving some of them in our ER, and we're also doing it at an outpatient location at our BSA Urgent Care Center. The process is working well at both facilities. We need to be very strictly adherent to the criteria when someone is a potential candidate, and that has to come with a physician order in terms of making sure they understand the criteria and are enrolling the proper patients. We will continue to utilize those resources provided to us and attempt to prevent hospitalizations as a result of using those therapies. In addition, we are also now making sure that we're continuing the scrutiny on our elective cases that are coming to the main hospital. Despite having a reduction in our numbers from a peak of around 200 inpatients within the past few weeks, we still have 145 patients, as I mentioned, confirmed in-house. And with a significant burden on our ICUs, we have to make sure that we're not allowing procedures that really truly can wait, that can safely be postponed. And we're letting our physicians be the arbiters of whether or not that patient is able to safely wait or not. We are having myself and others in our medical leadership in the hospital work with the surgeons to help make some of those decisions, and really trying to do our best to not delay someone who needs to have surgery because of a significant health condition. I think it's critical, again, to recognize the folks that have helped us get through the pandemic where we are today. I remember back in the middle of March when we had our first case at BSA, and here we now are at the midpoint of December. And again, vaccine is here. We couldn't be more excited. I think that it's critical for all of us to continue to be vigilant regarding our social distancing and mask wearing. Even once we get everybody vaccinated in the healthcare arena, once we start doing public vaccinations, it's going to be critical until we have national consensus guidelines in terms of any type of backing off the masking mandate. And really the critical piece there is that we don't know, even if you're vaccinated, whether you're going to be someone who can still harbor the virus, not be infected, but potentially transmit it to someone else. That's important for a healthcare worker, for instance, who's taking care of somebody who has an immune system that is not functioning properly. So I think we need to be very diligent with continuing to follow that protocol and recommendation to protect the loved ones in our family, to protect those in our community that are potentially going to be at higher risk still for getting infected. So again, the nurses, the doctors, the staff that have been managing our patients since March, we're lining them up first and foremost to get vaccinated. They're coming through with smiling faces today. They're very happy. They're looking forward to be able to continue to provide care for you as patients in the community, and they want to do so and not put you at risk. So this is something that I think is very exciting for us. Let's continue to work together and try to get our community as safe as possible. And we are here to take care of you when you get ill. We appreciate your protecting us by doing the right thing when you're out in the community. Thank you, and that's all I have today, David.
Thank you, Dr. Lementer. Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you. First, I'd just like to go to our numbers, and then I'll talk a little bit about vaccine here at the VA. Here in the Amarillo VA, we have 13 COVID positive patients, 6 of which are in our ICU. As the other hospitals have mentioned, we are seeing a downward trend of those. And I believe that's about half of what I reported 2 weeks ago. We continue to have some non-veterans, although we have not had any new non-veterans to our hospital. We have 3 currently, 2 of which are in our ICU. And in total, we've taken care of 21 non-veterans here at the Amarillo VA. Next, I'll go on to the vaccine. You may have heard 37 medical centers within the VA have received the Pfizer COVID vaccine because they had the storage requirements necessary to maintain that super low temperature for storing the Pfizer vaccine. And happy to announce that the first veteran vaccinated was a 96-year-old World War II veteran. She resides in one of the community living centers in Bedford, Massachusetts. And so that's how the VA started. And so there are some VAs within Texas that have received the COVID vaccine, the Pfizer one, Dallas, San Antonio, and Houston. So what you're probably asking here in Amarillo is, what about the Amarillo VA? When are we going to get our COVID vaccine? And so we are waiting for the Moderna vaccine to be presented to the FDA, which we anticipate will be tomorrow. I tend to follow the Pfizer took 2 days to get its approval. I'm assuming a very similar path for Moderna. Once that gets its emergency use authorization, EUA, approved by the FDA, and they begin to ship it out, then we expect to get some of that vaccine here. We expect that could be as early as next week, and our team is planning feverishly to make sure that we are prepared that once we get it, we can start administering it. Very similar to how the other VAs have responded, our first priority is going to be those living in our community living center and those staff that are working in our community living center. And so that will be our first priority to get those. And then we will begin to move to our COVID frontline workers in our inpatient and emergency room setting and so on, following a very similar pathway to what you're hearing from the other hospitals and from the CDC. And so once we get that next week, assuming that it gets the FDA approval, we will begin administering it rapidly. We are going to have a veteran teletown hall talking specifically. We figure most of the questions and most of our talking points will be on the COVID vaccine tomorrow at 6 p.m. So for veterans listening to this, please encourage when you get that call at 6 p.m. If you want to hear more about what we are doing, please stay on that telephone town hall, and we'll be taking some questions directly, but we'll also let you know what we've got, what we're working on now. I want to just remind veterans, we do continue to have our COVID testing available free to veterans. We ask that you just call, talk to our team here so we can determine, where that vaccine, or where that, where that testing will occur, and so to make sure that we're ordering the correct test for you. One thing I want to finish out with, as many of you know, I came from Walter Reed, where I was working in the military before retiring this summer. And one thing we saw at Walter Reed is the great support towards our wounded, ill, and injured soldiers, sailors, airmen, Marines, and the community support and the support that they got. I will tell you, I'm seeing the same support here in Amarillo, the Texas Panhandle community, for our veterans and our VA staff here, and absolutely appreciate what the entire community does. I had somebody tell me we've got a company in the area that wants to do a donation to our healthcare workers, but I heard that they've also done the same thing for BSA and Northwest. And so really appreciate all the community partners who are really reaching out to our frontline workers right now. Just want to thank our veterans who have been patient as we've dealt with this pandemic. We have made a lot of changes to how we are delivering healthcare, how much face-to-face interactions we've had, and we know it struggles trying to keep up with it. And we just want to thank you for your patience we've been going through the last 9 months. And then finally, I want to thank our employees. Our employees have dealt with how do we respond to this pandemic? What are we having to do? And we have made changes that have occurred not just monthly, not just weekly, daily, and sometimes hourly changes as to what we need to do now in response to this. And so appreciate their resilience and their ability to react and make sure that we are taking care of our entire community in the best way possible to respond to COVID. And then lastly, I'm going to mention the same thing, that as we begin to roll out this vaccine, it is important to realize We cannot let our guard down. We have to continue our mask wearing. We have to continue our social distancing, and we have to continue our hand hygiene. We want to wait and see what our response is till we can get that large community spread immunity before we begin to do that. And so we here at the VA are going to continue to wait to see what the CDC is putting out and what our VA is putting out as to lessen that. So I want to remind you, even if you're someone, whether it's an employee or a veteran that gets the COVID vaccine, we'll continue to follow those restrictions here. And so with that, thank you again for this opportunity to speak to our community and my fellow veterans. Thank you, David.
Thank you, Dr. Gonzalez. We'll now go Jared. Mr. Miller, how are you?
Doing good. Thank you, Dave. I just want to remind everyone that the drive-through testing center remains open. If you had symptoms you think might be coronavirus, please call public health at 378-6300 and you'll be screened for reference to the drive-through testing center. Really want to give a big shout out to our city team that's working at the drive-through testing center. It's been some pretty inclement weather over the last handful of days. That's really good work that they're doing out there, and they're really busy. So thank you all for really sticking it out in some cold weather. It's a big service to our community. If you don't have transportation and you are referred to the drive-through testing center, please call Amarillo City Transit at 378-3095. They will arrange for transportation to and from the drive-through testing site. We have two primary governor's executive orders that we are subject to, or that are affecting us more than anything else right now. Governor's Executive Order GA-29 does require face coverings when out and about in the community and when you're not social distancing. There are some exceptions, but very few. We also have the Governor's Executive Order GA-32. The primary takeaway from GA-32 is that as an area of high hospitalization, and we are still, although we've dropped that hospitalization rate over 11 points over the last couple of weeks, we are still at just under 30%. So we will not go below, we will not cease being an area of high hospitalization until we've had 7 consecutive days under 15%. Until that time, our businesses are limited to 50% of their occupancy capacity. Number of businesses are allowed to operate at 100%, and those include essential critical infrastructure, religious services, local government operations, childcare camps, recreational sports programs for youth and adults, and a couple of other beauty salons and things like that. Now, it is important to note that even in those places where 100% occupancy is allowed, it is either recommended or required for those areas to still be in compliance with the Governor's Executive Order 9, which requires face coverings. The City of Amarillo has modified our delivery plan in almost all of our outward-facing facilities that service our community and also service our internal departments. That alternative service delivery plan affects all of our departments. So if you have any questions about that, I can address those. I also wanted to just really echo what all of our medical team has said today. Thank you to our community for responding in such a strong way with your face coverings over the last couple of weeks. It's had a dramatic effect, positive effect on all of the metrics by which we're measuring our performance. Our hospitalization rate is going down. Our number of positives per day is going down. Our number of active cases is going down. And we will see a beneficial effect in the very near future if we can maintain that on our death rate. So thank you very much for taking that serious, for taking care of your neighbors. That's all I have, Dave, and I'd love to answer any questions.
Thank you, Jared. We'll now go to members of the media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of News Channel 10. Kevin, how are you today?
Hi, Dave. I'm good. Thank you. I guess for Jared, how will the city's, all those syringes, I believe it was 800,000 you bought in September, how will those come into play in the effort now?
I'm going to unmute and then I'm going to shoot that over to Casey. Casey?
So we will be able to utilize those when we are able to have community clinics, and then if we don't need those, then we will have those available to our public health department operations for immunization clinic and all of our other operations. We just certainly wanted to be prepared for anything that came our way.
to the hospitals, how are the employees, how do they get, on the list to be vaccinated? Are they ranked by their risk factors, or are they just volunteer?
I can start. This is Dr. Lamentier. We had to tier our employees based on what we felt the highest risk was based on where they work. So those patients that are spending the most time taking care directly of COVID patients in the ICU and on our med-surg units, our emergency room, where there is the greatest temporal association as far as the hours you work, the shift you work, what your role is, and being in the vicinity of a COVID positive patient or potential COVID positive patient, where we tiered those individuals to be toward the top. Obviously, it's a voluntary vaccination. I think many are certainly desiring the vaccination. Some are not for different reasons, and that's fine. And then we're bringing that to other individuals working in our hospital that are also direct patient caregivers and so forth.
Yeah, I'd say same thing. We did exactly the same thing as BSA, and then Dr. Lamentier and I have also worked together on making sure that we're accounting for all the physicians and providers in the community. They're also frontline. So pretty much all of the Texas Tech doctors and our colleagues there are frontline. So we saw a lot of those doctors come yesterday. So yeah, same thing. The highest risk first, and then we start going down from there.
Thank you. And can somebody explain to me, I've heard two different terms for the medical staff that are here from outside. Some of them are called RAC nurses, but then I've also heard them called traveling nurses. Can somebody explain if there's a difference, what the difference is?
Yeah, I'll just explain real fast. So these are all traveling nurses in the sense of they're nurses from outside the community, and they're all coming from one staffing agency that's working with the regional advisory council and the state to help support our causes at the hospital. So we call them RAC nurses because they're all coming through the RAC, but they are traveling nurses. Some of them from states up Northeast. I met some from Florida, so like that, and so they're all coming in to help us.
Okay, and who pays those people?
The state is paying the staffing agency.
Okay. And who's paying for the hospital, the vaccines being given now to the medical personnel?
There's no charge. Oh, go ahead, Casey.
You're fine. Go ahead. There's no charge for the vaccine, so that is being provided by the federal government.
Okay. And have we had any experience with what they call long haulers in the hospitals? The people who are there for extended period of time with COVID?
Yeah, I'm not, that terminology you're using is not something that we would use in the medical community, but necessarily. But yes, there absolutely the length of stay for patients that have COVID-19 and that require intensive care support has been significant. We don't yet have, we were talking about this with our management team, we don't yet have a national standard that we're aware of that really is what we call sort of that geometric mean length of stay, which is what's the expected duration for someone who has COVID confirmed if they only require a medical surgical unit stay or if they require an intensive care unit stay. That's kind of a standardized way to know whether or not our patients are staying shorter duration or longer duration than the norm. Because this is a new disease and condition, even though we've been managing it for 10 months, we don't have that benchmarking, but we do know that the patients that require intensive unit care are having very long length of stays in some cases, yes.
Okay, that's everything today. Thank you all.
Thank you, Kevin. Let's go to David Gay of the Amarillo Globe News.
Good morning, everybody. Hope you guys are doing well. I guess my first question is, we've seen about 20 days since the Thanksgiving holiday. I know that prior to the Thanksgiving holiday, there was talk about a potential spike coming from gatherings coming from in the area. About 20 days after, I mean, can the medical professionals in the room speak on that? If the spike was as intense as we expected, and what people should do preparing for the upcoming holiday season next week.
David, I'll say, Dr. Melton, you were going to answer?
Go ahead.
I was just saying, at Northwest, we did not even see a blip, to be honest with you, which is great news. So we didn't see any of the surge that we anticipated. Again, what would I attribute that to? I think that was right around the time that the city really put into effect some of the ordinances about masking. I think the warnings about being careful in terms of joint and getting together collective situations or populations all made a difference. But thankfully did not see any result of that holiday.
Yeah, I would agree here at BSA. I mean, clearly, we still have significant numbers in the hospital, but they're down from that level of about 200 patients confirmed in-house for a while down to the mid 100s, 145 to 150. That is not reflective of a significant upward swing beyond Thanksgiving. And I don't think there's any question that part of the reason that we're in this more favorable spot is because of the diligence of the community and helping out with wearing masks, social distancing, good hand hygiene, the things that we've been preaching for months, and the businesses that are cooperating with mandating that their clientele do the same.
So,
just real quick. The only thing I'm going to add is you did a follow-on question about what about does that mean for the upcoming holiday? And I just want to reiterate, as Dr. Weiss and Dr. Lamentier mentioned, the reason we don't think we saw much is because of how people were in compliance with face masks. We need to be doing the same as we look to this next holiday. We don't need to let our guard down because it wasn't as bad. We don't need to let our guard down because we have vaccine. We need to continue to follow the same precautions we have been. And, once again, like I made modifications to my plans for Thanksgiving, I've already made modifications to my plans for the upcoming Christmas holiday. And so I would just encourage people to still consider we are still in a pandemic, and we just right now seem to be on a downward slope of a surge, but it's still a pandemic. And so need to not let our guard down.
Thank you, Dr. Gonzalez. I appreciate it. My apologies for cutting you off. I guess my next question, would you also, so 7 days ago, according to my notes, the hospitalization rate for trauma service area A was at 35.7%, 77% rather. And then Tuesday's rate was 29.72. Would you also, everybody on the call, would you also relate that to the mask wearing and to the continuance of the safety protocols of community members and of businesses in the area?
In a word, yes. Yes, I would. I think that's helped.
Absolutely, absolutely. And I guess the last question that I have is there a plan for the COVID-19 report card being released during the holidays?
So yes, the only days that it won't be will be on the actual holidays like Christmas Eve, Christmas Day, January, like New Year's Day. So just on the actual holidays.
Absolutely. That's all the questions I have. Thank you, guys. I appreciate it. Have a good rest of your week.
Thank you, David.
Thank you.
Let's now go to Channel 4 KMR. I think this may be Aaron Langston, if I'm not mistaken.
Yes, thank you. How are you?
I'm good. How are you?
Pretty good. First question is, with the decrease in positives, are we also seeing a decrease in the number of tests, or is that staying pretty steady?
We have seen a decrease in the number of people who have requested testing at the test site, but we have certainly accommodated everyone who has called to be tested.
Yeah, we're still attempting to test vigorously for appropriate patients. I will say that we've had a little bit of a drop in our numbers of patients coming through our respiratory triage unit, which is adjacent to our emergency room. When patients come in with those types of symptoms, the numbers are down a bit from where they were, which is good news. And then again, that is typically directly reflected into the number of tests we're doing at BSA proper. As far as our clinics go, we're still testing at a fairly good rate, but our overall positives are starting to drop a bit.
All righty. And the state this week, actually, I guess last week, Friday, started reporting probable COVID cases. And one of the few areas that is not reporting those is Potter and Randall. Is there any plan to start reporting those numbers, or just keep it as it is?
Yeah, so, when the information is changing rapidly, and so when the new tests, like the antigen test came out and the different types of tests came out, we had to make a plan very quickly on how we would roll that into our reporting strategy. And so we did so, and then we received different guiding information from our state partners, and so we certainly appreciate those surveillance definitions. And so we are going to be looking at that and how we can report those. I think the thing that's important to remember is, even though someone is epidemiologically defined as a probable case, that doesn't mean that they don't have COVID-19. And so these are specific definitions that are like epi definitions, again, not diagnostic definitions. And so we are going to be looking at how we can roll out the definitions based on these state criteria, but we're certainly doing so in a way that is helpful and accurate.
All righty, thank you. And over the week so far, we've talked about the vaccine a lot, and it sounds like there's a plan in place to have the first round wrapped up by Friday or first of next week. Do we have a timeline of when the second round of vaccine, not the second dose, but the second delivery of vaccine could be hitting Amarillo?
I think that's yet to be seen. The state anticipates different allocations of vaccine, or new allocations of vaccine each week. And so we will be assigned vaccine as the state allocates that vaccine around the state. And so we'll certainly keep everyone posted as we know vaccine is coming.
All righty. And this one's for the hospitals. I guess what percentage of staff will be handled by this first round?
I would say that, looking at our slightly greater than 3,000 employees for BSA Health System, then we have to add on the medical staff members that work at our facilities front line but are not employees. And as Dr. Weiss mentioned, we're working on a plan to really try to divide up some of that between both hospitals. Texas Tech is a perfect example. We're going to hopefully get through somewhere around 25 to 30% in the first week, but it depends upon some additional allocation we may get tomorrow, combined for both hospitals. So again, that's a total estimate there.
Yeah, I would say the same thing. We're just between the physicians who are signing up and some of our frontline staff, our hope is just to really focus on those ICU nurses and those COVID unit nurses that have been there. Those are first priority, and we'd like to get 100% of those nurses done and those staff as much as possible before we move on to the next tiers.
All righty, I think that has me covered. Thank you very much.
Thank you, Aaron. Dalton Williams of KVI Channel 7. Dalton, how are you?
I'm good. How are y'all today?
Good, thank you.
Good. So my first question is for Dr. Milton and Dr. Weiss. Both y'all had talked about being able to feel the vaccine working. If you could just elaborate a little bit more on what that is, since the closest thing y'all have talked to about it so far is feeling kind of like a flu shot.
Yeah, I was actually joking, and all I can feel is a little soreness at the site.
Absolutely. I'm the same way. I think it was just the overwhelming optimism that finally it was here. But yeah, so a little sore arm, but I'm very confident it is working, but thankfully it's not picking on me.
Good, good. And then a lot of my other questions have already been either answered on in previous statements or by other reporters. Kind of just make this easy, quick and easy. Is there a message that the medical professionals have for people who are a little hesitant to get the vaccine when it does become available to the public? Kind of want some people who have said before, oh, we're not going to get the vaccine regardless of what's in it or not.
Go ahead, Scott. You go first.
Well, I would do it. I'm going to try to say and all the things I can to try to convince people to get the vaccine, because I think it's a wonderful thing. It's what's going to help us reach herd immunity sooner, and it's our path to getting back to normal. And so that's what you can do as a citizen. I mean, individually, it's going to protect you, and it's safe, and it's been tested vigorously. And so it's just a wonderful thing, and I would encourage everybody to consider taking it.
I totally agree with what Dr. Milton just said. I think that people need to remember that just because of the speed that we were able in this nation to come to the availability of vaccine in such a short period of time is partly because we have some of the most outstanding scientists in the world, number one. Yeah. Number two, there was a lot of work done on this vaccine in terms of the basic groundwork, if you will, back in the early 2000s. When you listen to the virologists that are talking on national TV and are being interviewed by the CDC and whatnot, you'll hear them say that groundwork really allowed us to be where we are today. The rigor around the studies for the vaccines has been outstanding. And I really think that we are fortunate to be where we are today. And again, as someone who is a very staunch critic of any type of treatment that we utilize, and I like to make sure that we're always looking at the details and the studies that are well done. The data here is outstanding thus far on these vaccines. So we need to remember, you're not just protecting yourself, you're protecting others. You're protecting those that have any type of immune compromise in your family, your friends, that you could be harboring the virus where it wasn't much for you, but it was a very big deal for them if you transmitted it to them. So we would encourage all who don't have a serious contraindication to being vaccinated to get vaccinated.
Yeah, great. And Leslie, I agree with that, all the comments. But the other thing is, by the time we have enough vaccine for the general population, that will probably be more towards the spring of 2021. And that will be even more months of data we have on the safety of these vaccines. So hopefully that will be reassuring to people when it becomes available to the general populace. But the other thing to remember is over 300,000 Americans have died from this virus in the last 9 months. And we cannot assure anyone that the implications of this virus cannot be long-term. I think there was a very scary video this last weekend of a young basketball player that collapsed on the basketball court. And it was known that he had suffered the infection, the myocarditis, coming from COVID. And my understanding is he's awake now, but that's the possibility of this virus, for all we know, could have implications for everyone's health down the road. And so I think protecting ourselves from getting this virus in the first place is the best thing we can do with this vaccine.
Okay, thank you guys so much. I really appreciate y'all letting me be on this meeting with you. Y'all have a great rest of the day. Thank you.
Thank you, Dalton. At this time, this concludes our news conference for today. I want to thank all of our panel members who took the time out to participate to provide this information to the community. Once again, we do these every Wednesday. This is David Henry. I'm Communications Manager for the City of Amarillo. We will see everybody next week. Thank you.
Thank you.